Guys, in our previous class of the I have discussed about the ileum of the hip bone, and in this class I am going to discuss the remaining part, that is pubis and ischium. Let's discuss about the parts. It's pubis and behind it is ischium, and pubis consists of the body and the rami. The body consists of the pubic crest and laterally consists of the pubic tubercle, and the surfaces are it consists of anterior surface, medial or symphyseal surface, and posterior or pelvic surface. And there are two rami, superior rami and inferior rami, and in the superior rami it consists of the border. There are three borders, that is pectinate line or pecten pubis, and then this is obturator crest, and behind it is inferior border, and surfaces consist of the three surfaces, that is obturator surface and pelvic surface, and this is pectinate surface. Okay, and in the inferior rami it consists of the inner surface, outer surface, and two borders, that is lateral border and medial border. Now let's discuss about the parts attachments. In the pubic crest, there is attachment of rectus abdominis and pyramidalis, and anterior margin of the pubic crest gives to the attachment to the anterior wall of the rectus sheath, and it is related to the medial head of the rectus abdominis muscle. And this is the pubic tubercle. You can see the pubic tubercle here give attachment to, there are 6 attachments, that is medial end of inguinal ligament, lateral course of the superficial inguinal ring, superior cross of the saphenous opening, apex of the lacunar ligament, reflected part of the inguinal ligament, and ascending lobes of cremaster muscles in male. And relation, pubic tubercle is related to spermatic cord in male and round ligament of uterus in female. Okay, now let's discuss about the attachment of the surfaces. This is the anterior surface. In the anterior surface it gives attachment to the adductor longus, gracilis, adductor brevis, obturator externus, and anterior pubic ligament. It attaches to a rough stripe on the medial part of the anterior surface, and the medial rough stripe on the medial part of the anterior surface. Okay, now attachment to the posterior surface. This is the posterior surface. It gives attachment to the anterior fibers of the levator ani and obturator internus. The posterior surface also gives attachment to the puboprostatic ligament, that is medial to the levator ani. There is attachment of puboprostatic ligament, and it is related to the urinary bladder. Okay, now let's discuss about the ramus, superior ramus, inferior ramus. Superior ramus consists of the pectinate line or pecten pubis. It is divided into the medial and the lateral part. The medial part give attachment to the from before to backward. Attachment are lacunar ligament, deflected part of the inguinal ligament, conjoint tendon, and fascia transversalis, and the lateral part gives to the attachment from behind forward, pectinate ligament of Cooper, pectinate muscles which arises from the pectinate line, and fascia covering the pectinates, and psoas minor if present. Attachment to the obturator crest. These are the obturator crest. In the obturator crest there is attachment of the pubofemoral ligament, which attaches to the lateral end of the obturator crest, lateral end of the obturator crest, and this is inferior border. And in the inferior border there is attachment of the obturator membrane. Okay, now let's discuss about the pectineal surface. This is the pectineal surface. There is attachment of the pectineus muscle and pelvic surface. In the pelvic surface there is a relation. The relations are lateral umbilical ligament and ductus differences in male, or round ligament of uterus in case of female. And this is the obturator canal. From the obturator canal the structure passes are obturator nerve, obturator artery, and obturator vein, that is from above to downward, nerve, artery, and vein. Okay, now inferior ramus. Inferior ramus consists of the lateral surface and the medial surface. Okay, lateral or external surface. External surface gives attachment from the medial to lateral. From medial to lateral, attachment are gracilis, adductor brevis, obturator externus, and an erector magnus. And in the posterior internal surface, posterior surface consists of the medial area, intermediate area and the lateral area. In the medial area, it is directly contact with the course of the penis, and in the intermediate area, it is related to the dorsal knob of the penis or clitoris and internal parental vessels, and in the lateral area, it gives origin to the obturator internus. And also in the intermediate area, it may give origin to the fibers of the sphincter urethrae. And the medial border, it gives attachment to fascia lata and membranous layer of the superficial fascia of perineum. Now let's discuss about the ischium. It consists of the body and the ramus. In the body, it consists of the anterior border, lateral border and medial border. In surface, it consists of the pelvic surface, femoral surface, and this is dorsal surface, which consists of the ischial tuberosity. Okay, now attachment of the border. Anterior border, there is attachment of the obturator membrane. And in the lateral border, it gives attachment to the ischiofemoral ligament. Okay, anterior border and lateral border gives to the ischiofemoral ligament. And we can see here, this is the ischial spine. The margins of the ischial spine gives attachment to sacrospinous ligament, and sacrospinous ligament separates the greater sciatic foramen from the lesser sciatic foramen. And the pelvic surface of the ischial spine gives origin to the levator ani and coccygeus muscles. And here is the relation of the ischial spine. It is related to the from medial to laterally. Medial to laterally, it is related to parental knob, internal parental vessels, and knob to obturator internus. And here we have the lesser sciatic nerves. The lesser sciatic nerves, the upper margin of the nerves near the posterior surface of the base of the ischial spine gives origin to the gamellus superior, and the lower margin of the nerves near the ischial tuberosity gives origin to the gamellus inferior. Here gamellus superior and gamellus inferior. Okay, now in the femoral surface, this is the femoral surface, this is the femoral surface, this is the pelvic surface. And in the femoral surface, this is the here we can have the attachments such as obturator externus, quadratus femoris muscles, and at the higher level of the femoral surface is covered by the piriform muscles. Okay, and this is the dorsal surface. The dorsal surface is divided into, it consists of the ischial tuberosity, which is divided into upper and the lower part by the transverse ridge, and in the upper part it is divided into again it's divided in oblique ridge. Superior and inferior part is divided by the transverse ridge, and superior part is divided by a oblique line into the superior lateral and inferior medial, and their lower part is divided by vertical ridge into the lateral and the medial part. Let's discuss about the attachment of this ischial tuberosity. Semi-membranous, that arises from the superior lateral part, semi-membranous, that arises from the here, and long head of bicep femoris and semi-tendinous, that arises from the inferior medial part. Okay, and erector magnus, that arises from the larger lateral part of the lower area. So here you have the lower lateral and the medial area, which is separated by the vertical ridge. From the lateral area, the arrangement of the erector magnus, and medial part lower area is covered by the fibroadipose tissue. Is covered by the fibroadipose tissue, which contains the ischial bursa of the gluteus maximus, and which supports during the sitting position. And the sharp margin of the ischial tuberosity gives attachment to sacrotuberous ligament. Here is the sharp margin which gives attachment to the sacrotuberous ligament. And okay, now let's discuss about the lateral border of the ischial tuberosity. And this is the lateral border of the ischial tuberosity, which gives attachment to ischiofemoral ligament just below the acetabulum. Okay, now pelvic surface. This is the pelvic surface. Upper greater part of the pelvic surface gives origin to the obturator internus. The other part is the ramus, which extends from the body of the ischium, and that joins the inferior ramus of the pubis, and the consists of the upper border and the lower border. In the upper border it gives attachment to the obturator membrane, and in the lower border it gives attachment to the fascia lata and the membranous layer of the superficial perineal fascia, and it consists of the surface, that is anterior surface and posterior surface. And in the anterior surface, from medial to lateral it gives attachment to the gracialis near the lower border gracialis, and adductor brevis, adductor magnus and obturator externus. These are from medial to lateral. And the posterior surface, the pelvic area of the posterior surface of the ischial ramus gives origin to the obturator internus, and the lower part of the perineal area of the posterior surface gives attachment to sphincter urethrae, ischiocavernosus and transverse superficial perineal muscle. And the relation of the upper part of the perineal area, it gives relation, it is related to the course of the penis or clitoris. The hip bone is ossified in cartilage from 3 primary centers and 5 secondary centers. In the primary centers, 1 for the ilium, 1 for the pubis and 1 for the ischium, and secondary centers, 2 for the iliac crest, 2 for the Y-shaped cartilage of the acetabulum and 1 for the ischial tuberosity. And the clinical anatomy, iliac crest, it is used for taking bone marrow biopsy in case of anemia or leukemia. And as before I have said that ischial bursa, which is ischial tuberosity bursa, which is for sitting position in the person, and for sitting for long period of time, this may get inflammation. As you know that the mid-inguinal point, that is the halfway between the anterior superior iliac spine and the center of the pubic symphysis, the femoral artery can be palpated here. And another is the pubic ramifracture, which is mostly seen in the elderly people after simply lower energy fall from the standing height. We can see in the X-ray the pubic ramifracture. And in the direct injury, such as in the road traffic accident, we can have the injuries in the sacroiliac joint and also in the acetabulum. Thank you for watching the video. Please do not forget to like, subscribe and comment.